COVID-19 has created a new normal for all of us in so many facets of our life, from how we shop the planning to visit doctors' offices. Our next guest is the president of the American Association of Endodontists and really is ready to discuss new safety protocols for in-person dental visits. We welcome Dr. Alan Gluskin, joining us by satellite from San Francisco. It's great to see you, Doctor.
It's great to be here, Jessica, with you.
This has been such an uncertain time in so many ways. That's an understatement. But in the area of oral health care and the practice of endodontist teams everywhere, we may have been delaying care because we weren't necessarily comfortable going out to seek medical help. But you talking today about why it is so important to stay ahead of that curve to prevent even further damage or future problems.
Well, a dental emergency can turn into a very serious emergency, and we need to keep patients now in this era of COVID away from the hospitals. They are just swamped. So a patient should understand that a toothache that wakes them up out of a sound sleep with throbbing pain in their jaw that they just absolutely can't get back to sleep is a toothache that needs attention. When you're eating hot or cold, and that cold, whatever it is, ice cream, can make your tooth ache for 10 or 15 minutes, something's very wrong. And it is most always the nerve of the tooth. Patients call it the nerve. It's usually a blood supply that forms your tooth when you're a child. It sits in the center of the tooth to form the root when you grow up, and it can get infected from decay. It can get infected from a lost filling. And if in fact it turns out that you have an inflammation that is serious, making the tooth hurt on its own or provoking pain, then you need someone who can manage the pain in a way that won't hurt you. You need someone who has the extra training to do the root canal to save the tooth. With high technology, you need someone who can take three-dimensional x-rays to see the tooth and the quality of the complexity associated with that particular tooth. You need an endodontist, and an endodontist is a dental specialist with 2 to 3 years more training in a residency that allows them to save your natural tooth for a lifetime, hopefully without causing you any pain. And endodontists are taking all the precautions now to protect you from things that could happen in the dental office and protect their staff from the patient as well. So we are using all the protections that are mentioned and advocated by the Center for Disease Control and the American Dental Association.
Doctor, that's a great overview of what would constitute a dental emergency, and certainly the distinction of an endodontist versus a dentist and when you need to see either or professional. We saw some video just a second ago about some of the precautions being taken now in this era of COVID-19. Are there things that are new to this field or being used during these times that maybe hadn't been employed before or that are especially important right now?
Well, there are a number of things that are new to the field. We use microscopes 100% of the time. If you go to a specialist, they're going to be looking down inside your tooth with a microscope that can magnify the image 10 to 20 times so that all the complexities that might be involved in that particular nerve space can be found, so that the specialist has a much better chance of saving your tooth for a lifetime. And those x-rays are taken outside the mouth, so we don't have to put a lot of films internally inside your mouth. And that is a new technology as well. Plus, we use something that's 100 years old, which is the rubber dam, to isolate you from the dentist and them from you, and just allow them to work on your tooth. So a dentist isn't crawling in your mouth anymore like we used to. Endodontists, especially with microscopes and rubber dams, and the three-dimensional imaging, are able to stay a distance from you and protect you.
It's amazing what technology offers. And as you said, being able to do those x-rays externally and being able to employ technology that's a century old to keep us safe. But these days, what should patients expect maybe when visiting the dental office in terms of coming in? When do we know it is time to go ahead and make that call to the endodontist, or are you typically referred by your dentist?
Well, first of all, if the patient needs an expert and they're having trouble getting in touch with their dentist, or they want to go directly to the expert, they can go to our website, findmyendodontist.com. They put in their zip code, and they'll be given several specialists in their area. They should know they need somebody when there's an unusual swelling in their jaw that is starting, and usually those ache when there's a spontaneous toothache or a triggered toothache that lasts a long time. You could just have had your dinner and be watching television and feeling a pulsation in your jaw. That is indicative of a serious problem that will need attention.
And doctor, any words of wisdom right now on the best preventative care? We may be delaying some of these or have a propensity for delaying our visit for our regular checkups, but we probably want to keep on top of those. And any preventative care that we should be doing at home outside of brushing.
Well, I'm still a dentist, and we all learned when we were kids, brush your teeth twice a day, all right? It's just unbelievable how many people don't do that. And the most important times to brush them is first thing in the morning when you wake up to disturb that bacterial plaque that grows all night, and then once well before you go to bed to disrupt it while you're sleeping. If you can use floss during the day, any of the adjuncts like water picks and other ultrasonic toothbrushes are very good, but twice a day, right hygiene, good hygiene, and letting your toothbrush dry out during those intervals when you're not using it is a really good tip.
Preventative care can make a huge difference, but it's when it's time, go see the professional. Thank you for talking with us, Dr. Gluskin. We appreciate it.
It was my pleasure, Jessica.
Absolutely. Very important information to keep in mind, and we'll share more information. You can head to our website. We'll post a link at WTVR.com/VTM.